Hello and welcome to our Friday webinar. And welcome Dr. Lamb. We've got Dr. Stephanie Lamb with us today.
Hi.
Hey. Coming straight from the clinic.
Yep.
Have we ever done one at your, you're always like taking your work. It's like you take a break in your work day to do these with us. So
Yep.
I just like totally appreciate the fact that you can do that and that you willingly do that for us. So very nice.
Yep. During my lunch break.
Wow. Okay. I mean, I hope we're not causing you to like skip lunch.
No, we're okay.
Been doing these for a couple of years. No, actually, so this is our 5th year, and you were our first episode ever. Just hit me right now that yeah, you were our first. So 5 years ago, we kickstarted these webinars with you. That's
Yep.
amazing. Yeah, and you're still with us.
Yep. Here I am.
Through all the- That's amazing. Okay, so as you're if you're logging on to join us, please tell us where you're coming from. Just 'cause I'd like to know. And the topic today, so Dr. Lamb, you're going to start doing like a deep dive series with us. And today you're gonna cover avian gastric yeast, correct?
Yep. Yeah. A common problem, but one that we see in the small guys. So
Okay, the smaller birds. All right, so let's see. We got people coming from everywhere. I love this. We got a pretty big crowd. Yeah, this is interesting. We got a pretty good crowd with us today. We got everywhere from New York to Washington to California to Texas to Minnesota, Sweden. There we go.
wow, Sweden.
Italy. We've got some international people with us
Wow.
today. Okay. Yes. Um, that's awesome. Okay. Chicago. Okay. So yeah, just tell us where you're coming in from, and then Dr. Lamb, I made you a co-host. And if we have time for questions at the end. When we get to there, just make sure that you use the Q&A feature, not the chat feature, with your questions. And we should start now because I know you got it's a big topic, I'm sure.
Yeah. All right. I'll go ahead and share my screen. Let me get my PowerPoint up here. And all right. So like we were saying, today's topic is going to be on avian gastric yeast. It's a common issue that we see, but it is something that's more common in the small guys. And a lot of people out there have these small little birds. And, you know, I think sometimes we forget about the little guys. We forget about the cute little cockatiels and budgies and don't always get a huge focus on them. But man, there's a lot of people out there that have cockatiels and budgies and love those little birds. And they've got such big personalities. And so I wanted to, focus on some specific diseases because in the past, we've focused on like a systems-based approach where we've talked about the cardiovascular system and disorders that happen there, or, the liver and disorders that happen there. So now I was wanting to more focus on, let's just talk about specific diseases that can happen, how it affects the body, and then, what we can do about it. And of course, I'm going to be very happy to answer questions at the end of this. So getting started, what is avian gastric yeast? Well, originally, this organism was something that people were finding in usually poop samples from birds. It's not uncommon when a bird goes into the vet that a fecal sample is analyzed. And the most common fecal sample that we look at, there's different ways we can evaluate a poop sample because looking at it in different ways kind of gives us different information. But one of the most common things that we do is a gram stain. And a gram stain allows us to look at the bacterial flora in the gastrointestinal tract and see what sort of organisms are there. Now, I'm sure many people who are on this talk have heard more and more about how we have an important gut microbiome, which means there's a lot of little organisms that live in the gastrointestinal tract that are supposed to be there. A lot of times bacteria get a bad rap because we think bacteria equals disease, which isn't the case. Really, there's a lot of little bacteria, fungal organisms that are present in the gastrointestinal tract and help maintain a normal, healthy environment in there. And so one of the diagnostics that veterinarians will often do, particularly with these small guys, because sometimes the small guys can be a little harder sometimes to collect things like blood samples from. Not impossible, for sure, we do it all the time, but they're smaller, so we can only collect so much blood. So one of the diagnostics we use in them may be a little bit more sometimes is just looking at the GI flora and seeing what's in the GI tract. And so what people started identifying was this large bacterial organism. And I have this picture over here of a stain of this organism. And originally it was called bacteria, megabacteria, because it was this huge thing that they thought was a bacterial organism. But as it turned out, after doing more like genetic studies and understanding whatever this big, huge structure was a little bit better, it turned out that actually this is not a giant bacterial organism like originally thought. And it was actually identified as a yeast organism. So you'll hear this called by different names because of the fact that when it was originally being diagnosed on stool samples, we didn't know exactly what it was. Once it was identified as a yeast organism and was able to be classified as the way we normally name things with a genus and species sort of name, it got the name of Macrorhabdis ornithogaster. So that's a big name, quite long. As you can see, I have it spelled out there, and not everybody wants to call it by that really gigantic name that it is. So it also took on the name of Avian Gastric Yeast. So you're going to hear it called by various things. Megabacteria is the old name for it, but there's still people who will call it by that because we know what it is. We know it's not a bacterial organism, but we know what we're talking about when we say megabacteria. You may hear people call it the actual name, Macrorhabdis ornithogaster, or Avian Gastric Yeast, or just to simplify, because in a veterinary clinic, it's very common that people like to give acronym names to things because it just makes it easier to do that. You'll hear people also call it AGY. So any of those names that you hear, it's all the same thing. It's this gigantic organism that was thought to be a bacteria, but is actually a yeast. Here's another picture down here. This is a fecal wet mount. So this is where the sample was not stained. It literally was poop that was mixed with some saline and put on a microscope side. And we see these long rod things. So these white rods that you see, that I'm trying to outline here, all these white rods, those are the organism that we're looking for. All the other stuff is just sort of shmoo, the stuff that comes through with poop, probably some bacteria and just like broken down food material. So same organism, just being looked at by different ways underneath the microscope, one with a stain, one without. So who do we actually see this organism most commonly in? Again, like I mentioned, it tends to be something that we see in the small guys. So budgies are sort of the poster children for this particular disorder. The other ones that we'll see it quite frequently in is zebra finches, actually. Other finches too, but zebra finches quite frequently. Now, part of that might be because these are two popular caged birds that are owned by people all over the world. Part of that may also just be a unique propensity for these species to carry this organism. Cockatiels are another one that we'll see it in as well. But by and far, I would say if I did a random sampling of budgies, zebra finches, and cockatiels, I'm probably going to find it the most in the budgies, followed by the zebra finches, and then the cockatiels. Now, it does sometimes pop up in other species. It's not unknown in other species. There's certainly documentation of it happening in several other small guys like the lovebirds, the parrotlets. You'll see it occasionally in other small finches. Your Gouldian finches can carry it. We'll sometimes see it in canaries. It has been identified in larger birds. In the literature, it's been documented in the galahs, or the rose-breasted parrots. And then I think the biggest bird that I've ever personally seen it in was a blue-crowned conure. I don't know that I've seen it in anything bigger than a blue-crowned conure personally. It has also been documented in other species of birds too that we don't often think of as like companion pets, but certainly could be quail, partridges, turkeys. So some of those birds that we're thinking more of, like game birds, farm birds, that sort of thing, it has been documented in them as well. So It's certainly something that can happen in a variety of species. It's just the budgies, the zebra finches, the cockatiels, those are the big three that you're most likely to see it in and have problems with it in. But again, even of those three, the cockatiels is like the least likely of those three to have it. So when we see a bird with this particular problem, when we have a bird that has avian gastric yeast, how do they present? You know, how do they come to the hospital? What are the signs that they're showing in the hospital? The signs that they're showing, one of the most common things that's going to alert an owner that something's wrong and cause the patient to come into the hospital is either regurgitation or vomiting. Regurgitation and vomiting are quite similar because some food is coming up out of the mouth when it shouldn't be, right? But technically, regurgitation and vomiting are actually supposed to be from different areas. Regurgitation usually means it's something that's coming like from the crop, or the esophagus, versus vomiting means it's something that's coming from the stomach and making its way up. In all honesty, it's very hard to tell the difference if it's regurgitation or vomiting in a bird. It's interesting because in veterinary school, they definitely really try to get students to understand the difference between regurgitation and vomiting. And it's you know, always a little more focused on mammals, right? So like they'll tell you all the different signs to look out for that say, hey, this is regurgitation in a dog versus this is vomiting in a dog. And that helps you because that makes you identify something's in the esophagus versus something is in the stomach. A little bit harder for us to make that distinction sometimes in birds. In reality, probably the vast majority of the time that a bird is bringing something up, most likely it's coming from more the esophagus or the crop, right? Because we know how birds are unique compared to mammals and they store food in the crop before it goes down further into the lower portions of the GI tract, the ventriculus or proventriculus, followed by the ventriculus, which is the stomach of birds. But sometimes you can see, I would say, a little bit more force of a bird bringing something up when it's potentially coming from the stomach. So if they seem like they're really working to bring something up, it might be more true vomiting as opposed to regurgitation. In all honesty, it's not a huge deal. We just know that, hey, birds bringing something up and it's not supposed to, right? Because birds are supposed to eat their food, swallow it, and it goes down, you know, just like anybody else. So if a bird is doing regurgitation or vomiting, that is something that often keys an owner in to say, hey, something's wrong here. We need to get the bird checked out. And that's usually what they come into the office for. But of course, they're often showing other signs too. And some of those signs can be really subtle and hard for people to identify. With the next biggest thing being weight loss. We see a lot of skinny birds when they have this particular organism causing an infection for them. You know, what's happening with the organism, the reason it's causing them to have weight loss and be skinny is the organism, avian gastric yeast, I'll just call it that for the purposes of this talk because it's kind of the easier one of all the names we have. That avian gastric yeast organism, it likes to live in the proventriculus, which is the glandular part of the stomach. Just as a reminder from other you know, talks we've had in the past when we've gone over the GI tract, or for anybody who hasn't seen those ones, as a reminder, birds have two parts to their stomach. They have the proventriculus and the ventriculus. Proventriculus comes first, thus the word proventriculus, it's in front of the ventriculus. The proventriculus is the more glandular portion of the stomach. It is more distensible, so like when food passes from the crop down into that portion of the stomach, into the proventriculus, it can distend a little bit more. That's where glands will secrete fluids and mucus and stuff to kind of mix with the food before it goes down into the ventriculus. The ventriculus is the portion of the stomach that is the more muscular portion of the stomach. So it's the portion of the stomach that's doing some grinding and trying to, excuse me, make food into smaller pieces so that it can pass down into the intestines. And once the food gets into the intestines, that's where it gets nutrients get absorbed. So that little organism, the avian gastric yeast organism, lives at the junction between the proventriculus and the ventriculus. It's still technically in the proventriculus, and it's at a portion called the isthmus. So it's like the very end of that proventriculus before stuff goes down into the ventriculus. And as it sits in that area, it can cause a lot of localized irritation. It can result in ulcers of the inner mucosa of the proventriculus. And it itself is gaining nutrition from, what the animals are eating. So it's in some ways interfering with your processing of nutrients because you're causing ulcers and damage to that mucosal surface. Things may pass through more rapidly. And also, it's taking some of the nutrition from the animal. So they end up not processing their food as well as they're supposed to, plus they're not getting as much nutrition from the food. Therefore, they end up losing a little bit of weight because they have to start pulling nutrition from body stores. So a lot of them come in underweight. But the reason it's difficult for owners to often identify that is because birds are covered in feathers, right? And so when we see weight loss in them, it's often hard for us to see it because those feathers are kind of covering up the muscle mass. And when they lose weight, they lose muscle mass weight. And it's not until the keel, which is that center bone over their breast area, becomes a little bit more prominent because the muscles have sort of wasted away around it. The keel, because it's bone, is then no longer having muscle mass on either sides of it the way that it should, making it appear more prominent. And then the feathers sometimes lay down a little more depressed on the sides of the body, and that's when people will notice that the bird has lost weight. Or if owners are weighing their birds with some frequency at home, they might pick it up before they're actually able to visualize that their bird is underweight. But really, the vast majority of them come into the hospital and owners don't even know that they've lost weight. It's when I pick them up and I feel them that I can tell, wow, I don't feel the muscle mass that I'm supposed to feel over the breast area. And it's because it's shrunken away because they've lost weight. One thing that is very commonly reported with this disease that often is not the reason owners bring the birds in. They may just mention it during the exam. They may not have recognized that it was an issue, is these birds usually have a very voracious appetite. They want to eat everything. And they often do. The owners are often telling us, oh, we ask them, hey, how's the appetite? And they're like, oh my gosh, he's eating great. And then if we probe them a little bit more and say, well, is it more than typical or is it the same? A lot of owners will go, yeah, maybe it is a little bit more than they used to eat. They're going through the food more rapidly. I have to replace it more rapidly, that sort of thing. And this picture here is a little zebra finch who's definitely surrounded by food. He's standing on some seeds. He's standing on pellets, and then he's also standing on some bread that was given to him as part of his food. And he was just trying to devour everything because he was hungry. This is an individual who had avian gastric yeast, and he was quite hungry and thus very stimulated to eat all the food that was presented to him. One thing that people will also often notice, but it's a very non-specific sign, is a quiet behavior or fluffed appearance to the feathers is the other thing. We've talked about it many times before when birds are sick, because they're so good at hiding signs of illness. The signs may be quite subtle, and sometimes it's just very non-specific, like being quiet and being fluffed. If you look at this picture of this little zebra finch, it's just one snapshot in time. But looking at him, his eye, you'll notice it's not as nice big round shape. It's a little bit more like almond sort of shape, you could say. And that can actually be a sign of discomfort. Now, if a bird's just resting and relaxing and you see that intermittently, not a big deal. But this bird, I'll tell you, kind of sat with that same sort of almond shape to the eye and not a nice, bright, wide open circular eye. And that's an indication of, I just don't feel good. So a little bit more squinting of the eyelids, very, very subtle sign, but something that a bird can exhibit when it is dealing with, well, any level of problem that's making it not feel great. Now, all those signs that I mentioned were a little more non-specific and could be from a variety of different things. So I wanted to go over a few more, potentially slightly more specific signs that might be seen as well. One thing that we could potentially see is loose stool. Again, because the organism is sitting in the stomach and is causing ulcers and irritation, it's making it so that they are not absorbing nutrition the way that they should. Things may pass through the gastrointestinal tract more rapidly. We may end up having just loose stool. It may also be quite watery. So normally when we look at a fecal dropping, so when a bird has passed something from its cloaca, usually there are three components to the dropping. There is feces, there's urine, and there's urate. The feces, that is coming from the gastrointestinal tract. The urine is coming from the kidneys, and the urate is also coming from the kidneys. Looking at this poop sample that we have right here, it is a very loose sample, poorly formed. And then also what you'll notice is there's whole seeds actually passing in the droppings. Very abnormal to have whole seeds passing in the droppings. If you have whole seeds passing in the droppings, that is an indication that they are not absorbing nutrition the way that they should at all. The body's barely even processing what's being passed through this bird who pooped this out. But looking at this poop sample specifically, where we can see some feces that is some level of digested food, it's quite loose, but the green portion is the fecal component. If we look up here in this area, you can see these little white wispy things. Those white wispy things and like this little bit of white wispy stuff on top of the stool sample over here in a couple places, that's the urate. That is the white part of the droppings. That's coming from the kidneys. It's actually, urate is also uric acid. It's a breakdown product of nitrogenous wastes or proteins. It should always be nice white coloring. If that urate is a different color, it could indicate other problems. But when it comes to avian gastric yeast, usually you're seeing the urate still being nice and white. So I didn't mention anything more about it, but just good time to talk about poop. And then when it comes to the watery like component, you can kind of see that there's just moisture around the droppings here that's kind of getting absorbed into this little stick. So there's a lot more moisture and water or urine passing through this dropping than you typically would see. And other thing that you might see with the bird's stool when we're dealing with avian gastric yeast is you might see something called melena. I don't have a great picture of that, but melena is where you actually have digested blood passing through in the droppings. And so digested blood actually looks black. It almost looks like coffee grounds black is what people will often describe it as. And sometimes it's hard to tell because sometimes little droppings from birds, like once they dry out, the droppings can look black. So you need to really analyze it on a fresh sample for melena to assess for black. And what I'll often tell people to do, if you're looking for black droppings that indicate they have digested blood coming through their droppings, is take a fresh poop sample and smear it out on a white paper towel. If on that white paper towel there is, a black smudge, that's truly melena. That's a problem. Versus if you smear a poop sample out on a white paper towel and it has more of an appearance like, this down here, which is kind of this green, Okay, that's okay. It's okay to have green in the droppings or brown in the droppings. It's just sometimes when it's all clumped up together, it's hard to tell if it's black or not. But when you smear it out, if on a white paper towel, it leaves a green smudge, you're okay. You're not dealing with melena. Now, melena isn't great because, again, what does it mean? It means there's digested blood coming through. Digested blood means that there is a upper GI tract bleed, which usually means that there's some level of ulceration happening because of the organism, causing localized damage in the stomach. It's usually causing some level of ulceration in the proventriculus, potentially the ventriculus as well, leading to bleeding. That blood gets into their GI tract, it passes down into the intestines, and the intestines, what does the intestines do with stuff that's passing through it? It tries to, it mixes it with enzymes to break it down so they can do some digestion, and then it tries to absorb nutrition and stuff from whatever's passing through. And so by the time blood gets from the stomach to the cloaca to be passed out, it's been digested, and so it has this black appearance. Two very non-specific signs that are unfortunate. One is just no signs. Some birds have avian gastric yeast and they have no signs and they're acting completely fine and life is okay. They may just be a carrier of it, but not actively have problems from it. And then the other unfortunate thing that happens sometimes is death. Unfortunately, if because birds are great at acting like everything's fine and trying to hide their signs of illness, if they are being really skilled at hiding those signs of illness, owners may not notice that they're eating more. They may not notice they're losing weight. Maybe they may not even see them doing any level of regurgitation or vomiting because the birds are, again, being really good at hiding that behavior from happening. And then they may waste away and suddenly pass away. So how do we diagnose this organism? What can we do? Well, I kind of mentioned it a little bit in the beginning. The way people first identified it was looking at it under the microscope. And that's really the main way that we usually will identify it. We can do these direct saline mounts, which was what I had a picture of, where you just take a piece of poop, you mix it with some saline, you put it on a microscope slide like we have here in the picture, and you look at it underneath the microscope and you're looking for those long rods, those like tubular structures underneath the microscope. We can also do special staining. The most common stain that's done with bird poop is what's called a gram stain. In these situations, we take a poop sample from the bird, we smear it out on a microscope slide, we let it dry for a moment so that the fecal material kind of adheres to the slide, and then we do our gram stain, which stains the bacterial organisms, stains the fungal organisms, it stains the background material, and then we look at that on the microscope and see what we can see. Generally speaking, we want birds to have a predominance of gram-positive bacteria. Again, looking at these poop samples, there's going to be bacteria there, healthy, normal flora should be present in the GI tract of birds. And it's mostly going to be of the type of bacteria called gram-positive bacteria. Generally speaking, there's two main bacterial groups, gram-positive and gram-negative. And most of our birds with healthy, normal stools should have gram-positive bacteria. A little bit of gram-negative is okay, but nothing substantial. It's kind of debated depending upon who you ask how much gram-negative bacteria are considered appropriate. Some people say none, some people say up to like 10% is okay, but very minimal is the whole point. When we do a gram stain and there's avian gastric yeast, though, we see this gigantic rod-like thing that looks like a huge bacteria, like amongst the population of all these other little bacteria. So they're usually kind of, once you recognize them and have seen them, they're kind of, in some ways, they're easy to find because of how large they are compared to the other bacteria. Like you're going to see all these little small tiny bacterial rods and cocci, like just little dots, and then there's this big giant thing that suddenly shows up on the microscope and you go, oh my gosh, that's 5 times the size of that bacterial organism. That could be our megabacteria or avian gastric yeast. At the same time, there is a little bit of difficulties with gram stains and identifying the organism. because when we're making that slide and we're preparing it, for whatever reason, avian gastric yeast organisms don't like to stick to the slide so well. So the way we do these stains, it actually is a series of a few different types of stains, and we have to like, we put one stain on, it sits for a moment, and then we wash it off, and then we have to put another stain on, and it sits for a little bit, and you wash it off, essentially. So it's this whole process. And then that washing off of the stain, sometimes the avian gastric yeast organisms can get washed off the slide. So gram stains are great in that they're really helpful for identifying bacterial populations. But if we are worried about avian gastric yeast and we don't find it on a gram stain, we can't rule it out. We often have to do other diagnostics to really look for it. And in fact, the saline wet mount, that may be a little bit better than doing the gram stain. So gram stain's great. When you find it, great, you got your answer. But when you don't find it, you can't rule it out. You may need to do a saline wet mount. Those seem to have a little bit higher yield of identifying the organism. But even then, you know, as you saw in the one picture at the beginning, it's just this, well, I'll go back to it real quick. Let me scan back. Okay, there we are. So when you're looking at this underneath the microscope, it's all these little rod things, right? But like, those are just little weird white looking sticks. So when you're first identifying this organism, if you haven't done it before, it's very easy to think that's just background debris and not recognize that that's actually a problem. So our saline wet mounts, they're good. They're probably better than the gram stain, but they also have their difficulties because it kind of just looks like shmoo mixed in with more shmoo. So, you know, a little bit of difficulties there. Therefore, the most helpful diagnostic that we have available to us is doing a PCR. PCR stands for polymerase chain reaction. It's basically looking for the genetic material or the DNA of an organism. And so you can collect multiple poop samples throughout the day on a bird. And it's kind of nice to do that because when you get multiple samples, you're more likely to pick up on the organism at some point because they may not be always shedding the organism. So like in every poop sample that they pass, maybe this poop sample has the organism in it. Maybe that poop sample didn't because it just wasn't being shed through at a particular moment in time. So you could miss it there too. But when we do these PCR tests, we can collect poop samples multiple times in the day, or multiple poops in, you know, a set period of time. We send it out to a lab. They do this PCR test to look for the organism. It really is probably the most sensitive way that we currently have available to us to detect the organism. And then if it comes up positive, great. Comes up positive, we know what we're dealing with. Recently, in the last several years, there is also a newer technique that some people developed, a centrifugation technique, where basically you take the bird's poop, you mix it with saline, you centrifuge it the centrifuge is like a machine that spins really fast that helps to like separate substances in a fluid, you could say. And so that centrifugation technique that some individuals came up with really in the recent past was found to actually help increase the yield of identifying the organism. So we've gotten some techniques that have been developed that help us a little bit more to really try to isolate this guy. So it's on the one hand, hey, it's a simple sample, it's just a poop sample. It's not like it's a hard sample to collect. On the other hand, there are just a few little individual issues with the different ways we analyze the poop sample. And so, you know, there are some difficulties. It's easy to diagnose and difficult all at the same time. So things we just have to keep in mind as doctors when we're trying to decide, do we want to test specifically for this? Are we looking for other things? We may have to do a combination of tests to really identify this organism versus other potential pathogens that could be in the GI tract causing issues. Okay, so let's say, you know, an owner has brought a bird in and we, you know, have a strong suspicion that it has avian gastric yeast, and we've tested it and aha, we have identified the organism. the next question is, well, what are we going to do about it? How do we treat these birds that have avian gastric yeast? There are a few different medications available to us. And over the years, there have been different concentrations of the medications, dosages, time frames of giving the medication that have been found to be effective or not effective, things that people have tried. And so you may hear a little bit of variability when you talk to different veterinarians, because some people like one particular treatment over another. I mean, to be honest, I have my opinions, and my opinions may be slightly different from somebody else's opinions, and it's just based off of experience, right? So like, as veterinarians, we read the literature, we identify, you know, what's best based on other people's experiences, but then we also have our own experiences where, you know, sometimes it might be slightly different, but that's why you might hear a little bit of variability in what treatment is the best. But the treatments that I put on here, the first one is amphotericin B. Amphotericin B is an antifungal medication. It is something that is probably, well, it probably is our current best medication that we have for treating avian gastric yeast in birds. Again, the doses are variable depending upon references that you look at. I usually will go with a higher dose of 100 mg per kg twice a day, and I usually do it for a full month in birds. I do know some people who do it for shorter and have had success at shorter frequencies. I just haven't always had so much success at shorter frequencies with this particular medication. This organism isn't always the easiest to get rid of, and I'm going to go into that in just a little bit after we go over some of the treatments. But amphotericin B is an oral medication. The way that the drug is now formulated, it's formulated so that it doesn't really get absorbed so well systemically. It just stays sort of mostly in the gastrointestinal tract, works its way through the gastrointestinal tract, which is where the organism is that it needs to treat. So it just goes into the GI tract, kind of works locally to affect organisms in that GI tract, trying to kill off the avian gastric yeast organism. But again, it does usually take a little bit more long treatment time to deal with it. Another medication that has been used for this, I personally haven't had a lot of success with this one, but fluconazole is a medication that some people do find a lot of success with. In fact, one of the other doctors that I work with in the hospital where I currently work really likes fluconazole and has had more success than I have with it. You know, what's the difference? I'm not sure. But you know, some people really like the fluconazole. Also an antifungal. It does have the ability to be absorbed systemically, so it's not as localized of a treatment. There are some studies in chickens, because like I had mentioned earlier, that we don't see it and think about it a lot in our like game birds, our farm birds, that sort of stuff. It has been identified in them. And so in chickens, fluconazole has been found to be effective. But in studies with budgies, it's found to be not so effective. So, you know, not always selected for use by all clinicians. Another medication is nystatin. Nystatin, again, also an antifungal. This one is just in the gastrointestinal tract. It does not get absorbed systemically. It just, when you give it orally, it works its way down the GI tract, just working locally. Almost, some people have called it like a lotion. That's just sort of like in that coating of the GI tract and helps to deal with fungal organisms just topically. Now, it is not the most effective for getting rid of avian gastric yeast. I really don't use this one as my main treatment. How I use this one is the amphotericin B medication. It has to be compounded. And so what I mean by compounded is a pharmacy makes it to the particular concentration that the veterinarian wants it made to. And so while some hospitals carry it, not all hospitals carry it. I happen to be in a hospital that doesn't carry it, so we have to have it compounded. by a pharmacist. And so sometimes that takes a couple of days for that medication from the time that we call it in to the time that it's ready for an owner. It may take 2-3 days before an owner is able to start the medication. And so sometimes in those cases, what I've done is I have started the nystatin just to kind of work a little locally and be a little helpful, but I know it's not getting rid of the organism. Anecdotally, I would say that I think sometimes when I have had to do it that way, because I can't get them on the amphotericin right away, it's at least seems anecdotally like it is helping soothe the GI tract, that they may be feeling a little bit more comfortable. Maybe they're not regurgitating as much. Maybe they put on a gram of weight, maybe they don't have as loose of stool. So it's helping a little bit, but I know that it's not getting rid of the organism, and I know I need to do something more. So I'm only really using that as like a Band-Aid, you could say, while we're waiting for the other medications to come in when we have to call them in. And then the other thing I put on there is sodium or potassium benzoate. I forget exactly when it was presented, but at one of the avian conferences that happens every year, maybe it was like 10 years ago, I want to say, approximately, we're going to say somewhere between 10 and 12 years ago, somebody had presented on putting potassium benzoate into drinking water for colonies of birds or flocks of birds to deal with this organism. And it did actually show some efficacy of helping to get rid of the avian gastric yeast organism from their system. But there are the potential for complications and side effects with this one. If birds are drinking too much of it, it could potentially be toxic for them. So like the researchers basically had the stipulations of, okay, it has to be in an environment where it's not too hot, so birds aren't stimulated to drink more. It has to be during times where birds aren't nesting, because usually during nesting time, birds are drinking more, because their own metabolic demands require it, because they're going through hormones and their metabolic demands may be up, but also if they're feeding babies, they're bringing in more to feed their babies as well. So if somebody is using sodium or potassium benzoate in drinking water for treatment of flocks of birds, they just have to be cautious to make sure that it's not a hot environment or birds are actively breeding during the times of its use. Other things that we need to think about, because those medications were very specific for the organism in trying to get rid of it. But a lot of times, by the time these birds are in the hospital and showing signs of illness, they usually need a little bit more supportive care, because usually things have been going on for a little bit longer and they need more than just the medications to deal with their problems. They may need supportive care in the form of fluids. Again, when you have really watery droppings and fluid is just kind of passing through the GI tract, the stools are just so loose and watery, well, that fluid isn't hanging on the bird, right? So the bird may be dehydrated, and it may need to be given some subcutaneous fluids so that it can sort of slowly absorb those fluids throughout the day for them to help maintain their systemic hydration. Another thing that has been used, there's a medication called sucralfate. That medication can be used to coat the GI ulceration that can happen from the organism, because again, remember that organism can cause ulcers in the GI tract. Those ulcers can bleed, that can cause melena. If we see melena in the droppings, that's going to be a case where I go, this bird could benefit from me putting them on sucralfate. So that medication sort of coats over the ulcers, also kind of acting like a Band-Aid, so that things can kind of heal underneath it. And, if you've ever had a GI ulcer, you know that they're not very comfortable. And so you may not want to eat much, or you may feel like throwing up when you have a GI ulcer. Well, our birds probably feel exactly the same way. So getting something that can coat over those ulcers so that they can feel a little bit more comfortable, they maybe not feel as nauseous, maybe they'll eat a little bit better. All that stuff is really important as just part of the supportive care to get these animals through this. For some birds, we'll also put them on medications that help stimulate normal GI motility. again, as mentioned, one of the most common reasons a bird is coming into the hospital is because owners notice it's regurgitating or vomiting. And food is supposed to go from the mouth down the GI tract, out the anus. It's not supposed to go down the mouth into the stomach and then come back up. You know, it's not supposed to come out the mouth, right? We want it to stay in the mouth. So we want our intestinal, or, you know, gastrointestinal, I should say, motility to be functioning in a normal fashion that moves things from one end to the other in the appropriate direction. And so we can give them medications that stimulate that normal contraction, stimulate normal motility, so that hopefully they can keep things down and not want to be doing regurgitation and bringing things up. Metoclopramide is just one example. Another one is cisapride. There are some other things out there that have the potential to help with that as well. But just personally, I probably use metoclopramide the most. Other things, we may need to be doing some assist feeding with birds that have avian gastric yeast. Again, even though they may be eating okay, they may not be getting all the nutrition they actually need from the food that they're taking in. I put this picture here. That's actually my personal chicken who didn't have avian gastric yeast. She was actually had some other intestinal problem. But it was making it so that she wasn't digesting nutrition the way she should, and she was losing weight. And so we actually put her on omnivore care, which is a Lafeber product. So just quick plug, omnivore care. As a veterinarian, I don't know any veterinarian who doesn't like omnivore care. Omnivore care is some great stuff. You know, it's just you can see it on the bag there. It says nutrition for debilitated omnivores. So it is a nutritional product that was formulated to be an easily absorbable nutritional formula for birds. Like birds barely even, and other species too, but it was mainly kind of behind birds originally. It's really meant to not have to be even digested very much by the bird. It's broken down into some very simple, basic elements that the bird just has to absorb the nutrition. So it can be really helpful for a variety of problems, but in these situations when we have birds that are more debilitated from dealing with avian gastric yeast, I might be putting them on some omnivore care as a little bit of a supplement. Usually it comes as a powder, and you can see me like holding the thing up there and showing the powder. You mix the powder with water, you make it the consistency of like a baby food, and then you can syringe feed it. But my chicken, like, she loved it so much. All I had to do was hold up the thing to her, and she just, the little scoop of the omnivore care to her, and she just ate it herself, and it was very helpful. One other thing that I will often do too is for the small little guys, particularly the finches, because the finches, you know, finches are a little bit more stressed by handling. And so though you certainly can assist feed them, I'm a little bit more cautious with having owners do assist feeding with their finches, because most finches aren't hand tame. Absolutely, I know some finches who are amazing and hand tame and really do well with handling, but a lot of them aren't hand tame. And because a lot of them aren't hand tame, you know, picking them up to not only give them their medication, but then have to do assist feeding with them can be kind of stressful. We don't want them to aspirate on anything. We don't want them to, you know, die from the stress of so much handling. So with them, what I've done some is actually, I'll instruct owners to get frozen peas and corn. That, you know, you go to the grocery store in the frozen food section, usually there's like a pea corn combo, you know, like a little bag, and you can warm that up for them, and even like squish the peas or squish the corn to like have that waxy outer coating of the pea or corn kernel removed, and it just be the contents inside. I've had little finches do really well with picking up on that, because corn, it's, you know, some people don't like corn, you know, sometimes there's controversy about nutrition in corn, but one of the things that's great about corn is it is an easily digestible carbohydrate. And so when you have a bird who is dealing with very in a debilitated state where it is really underweight, it is having poor nutrition, and it needs some carbohydrates so that it can have the energy it needs to survive, because a lot of our energy comes from our processing of carbohydrates. A little bit of corn actually can go a long way. So it's a simple little thing, but I've used it a lot in the little finches, and seen them put on weight associated with it, which is, just additional support that's needed for these guys. Okay, so let's say we have a bird come in and we find it has avian gastric yeast, and we put them on the treatments, we do whatever supportive care is necessary for the individual, because all the supportive care things that I just mentioned, not every single supportive care thing that I mentioned needs to happen in every single bird. It really depends on the individual, how they are presenting, what level of additional supportive care they may need, or maybe they don't need additional supportive care because maybe, they're doing okay, but we're treating it because maybe one individual's, you have a couple of birds in a house together where one's having a problem and the other has it but isn't having problems. We want to get rid of it in them too. So we're just treating them with medications, but maybe the one who's showing more symptoms is going to be on supportive care. Again, highly variable. It depends on how the animal's presenting and, at the discretion of the veterinarian to decide what level of additional support is needed. But after they have been treated for the appropriate length of time based on the medication that's being used, it is really, 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 really important to recheck these birds. And the reason it's so important to recheck these birds is because you don't always get rid of the organism the first time around with supportive care. You can have this be a kind of persistent and annoying problem that may take multiple rounds of treatment before you actually really get rid of it. So you have to recheck samples to see if you got rid of it. And what I will often do is I may have the owner bring the patient in, I look them over, they may be looking great. We'll often check an in-house stool sample. If I see organisms still there, okay, I then just get them back on the medication and we go for a little longer. But if I don't see any organism on the stool sample in-house, then I'm going to send out stool samples. So we'll collect a few stool samples while the patient is in the hospital, and or I'll have the owner collect them at home and bring them in. And then we send that off for PCR. Since the PCR is the more preferred way to diagnose the organism, it captures more organism when it's looking at a stool sample. That's this diagnostic that I really want. And if I will treat a patient until they are PCR negative if I can. Okay, which brings me to the next sort of frustrating thing about this, is that the prognosis for avian gastric yeast, many of them resolve. Many of them we can treat the organism and get rid of it, but not always. For some individuals, it can be a long-term annoying problem. I would love to say that, hey, we treat it one time with the amphotericin B at this dose, you're going to get rid of it in all individuals in the flock, and you're never going to have a problem from this ever again. The unfortunate reality is we're lucky when we get it with one time. And if we have one single bird that we're treating, like if this is a single bird in a single bird home, those are the ones where I tend to have more success of, okay, maybe we can get rid of it in one round of therapy. If I'm treating a flock of birds, that's when it can become a little bit more complex and difficult because the organisms shed in the stool, right? So like if you have a bunch of birds living together in an aviary situation, we know birds poop a lot, and they may poop on certain things that you don't intend for them to poop on, but hey, that's life, and with birds it happens. And so if even if you're treating everybody in the flock, like, are we able to get them the medications easily, pick up everybody and give them everything orally appropriately? What if one individual has a little higher organism in their GI tract, one has a little lower, maybe the one with higher organism is shedding it, poops on something, somebody else steps on it, then goes and cleans their feet, and they just inoculated themselves with the organism. And sometimes it can stay in an environment when you have multiple birds a little bit longer and can take a while to resolve. And then I will say I have had some cases, thankfully I don't have them happen often, but I do have some cases where we treat it and the bird just does not clear it long term. I currently have one case that I've been treating, in an amazing little budgie, such a great little bird, who we have gotten him to the point where he's PCR negative, which is great. But then it comes back months later. So there's still probably somewhere in that GI tract that just at the time when we're doing the PCR testing, he may not be shedding it. And so give him time off of meds and things slowly start to come back. There are some cases, and again, these are extremely rare, and I usually don't recommend this. But there are some cases where I have done more of like a pulse therapy, where like it's been a case that we just really have not been able to clear it. And we know when we stop medications after a period of time, their signs are going to come back. So sometimes I have done some pulse therapy to try to keep numbers low. The problem with pulse therapy of any sort of antimicrobial thing is you have the potential for developing antimicrobial resistance. So it's generally not recommended, but I will say there are a couple of cases where I have done that and it's been appropriate for the individual, but definitely not something I recommend as a routine thing. Yep, okay, that was my last slide. So at this point, I know we're close to the time here, but hopefully I've left a little bit of room for any questions that people have.
Okay, let's see. Yeah, no, that was amazing. Let's see if we have any that I mean, we have questions for sure. We got a lot of questions.
All right.
Let's see. I'm waiting for, okay. Okay. So, Budgie, they have a Budgie that's on, doxycycline.
Okay.
Sorry. Thank you. I'm going to say a bunch of words of flubamol, doxycycline, and then intraconazole. Okay. And then fluxanol for months. None of them have worked, and they tried Ampho-B, but he's not able to tolerate the potent medication. Is there anything else they can do? He's very up and down with symptoms, sometimes totally fine, and other times fluffed and depressed with intermittent episodes of violent gagging. So is there anything that they can do? And I'm sorry if I killed all those words.
No, that's okay. So it sounds like they're on doxycycline, itraconazole. The one I wasn't quite sure, maybe it was like fluconazole, or maybe it was a brand name for
fluconazole. Yeah, that was it.
And then the last one is amphotericin B. So the fluconazole, the amphotericin B, those are the main ones for treating avian gastric yeast. Doxycycline is going to be for, I'm guessing maybe the bird has some other, sometimes you'll get a avian gastric yeast infection, and then that, because it causes so much irritation, ulceration, localized inflammation, all that sort of stuff, you get a secondary bacterial infection. The doxycycline is going to be more for treating bacterial infections. It does have some anti-inflammatory properties to it, so I'm just going to take a guess that that bird might also have a secondary bacterial infection. So this is a case if the bird is really having a lot of problems despite being on, you know, fluconazole, amphotericin. This is a case where maybe it could benefit from some of those like pro-motility agents like metoclopramide or cisapride that could help reduce the regurgitation. If this is a bird who, and I don't know because I didn't say this, but maybe this bird does have melena, if it's maintaining more of a longer term signs and symptoms from this infection, it might benefit from being on some sucralfate as well. So that's what I'd probably recommend they talk with their veterinarian about, is what about the supportive care side of things as opposed to just the antimicrobial side of things. Maybe we need some pro-motility agents like metoclopramide or cisapride. Do we need any antacid sort of medications or medications that coat ulcers like sucralfate?
Okay, and then we have a question. How many of the 5 signs are apparent when a bird has AGY? So their bird has one sign, which is a voracious appetite, and he also has watery stools. And the vet says that he has metal-lead poisoning, metal/lead poisoning. Are the symptoms similar, and should they ask him to test for AGY? AGY. It's a lineated parakeet.
Oh, okay. So unfortunately, yes, the signs are of heavy metal toxicity can mimic avian gastric yeast infection. It can also be something that's seen with other types of yeast infection like candida yeast infection, or just a bacterial infection of a variety of different types of bacteria that could be in the GI tract. It could also be signs that you would see with a bird who has eaten some foreign object. So unfortunately, some of the symptoms are not really specific. Well, I would say none of the symptoms are really specific that we would go, oh my gosh, here's this one symptom we're seeing, and it always causes avian, or it's always seen associated with avian gastric yeast and nothing else. That's not the case. Unfortunately, the symptoms we see with avian gastric yeast can be symptoms of other diseases. So in this Linny, you know, testing for heavy metals, absolutely something that can be done. But also wouldn't be a bad idea to check a poop sample and do look for avian gastric yeast. And I would probably, if they don't see it on, again, a regular stool sample in the hospital, do the PCR test, because that's the more sensitive test, and best to collect multiple stool samples throughout the day. Bring in, you know, a catch of stool samples to the vet. They can send off the whole like stool sample collection. The lab can kind of homogenize it and test it for avian gastric yeast and see if that is something that could potentially be present.
Okay, and then someone asked, what's the difference between a yeast issue and colostrum? They have created a fresh sprouts many times and done them correctly, and did it with the help of China Prairie owner in terms of the rinse, clean, grow, etc. And 2 times their teal got GI infections. One time it was the Clostridium, wondering if any relation between the yeast and the sprouting. One time told too much good yeast and was prescribed antibiotics. Why antibiotics for a yeast issue as well?
Okay, so a yeast infection versus Clostridium.
Yes.
Okay, Clostridium. Okay, so Clostridium is a bacterial organism, and actually Clostridial organisms can be present in very low numbers in the gastrointestinal tract in birds, but it's really pretty low numbers. Sometimes those numbers overgrow for a variety of reasons, whether it's because they're immunosuppressed, or yeah, maybe they did get some yeast overgrowth that altered the local immune system, making it so that you get the secondary overgrowth of Clostridial organisms. They are separate things, but you could potentially have multiple problems at the same time because of the localized GI health being abnormal. Clostridium, because it's a bacterial organism, is usually treated with antibiotics, versus your yeast infection is going to be treated with antifungals. And if it's this organism, avian gastric yeast, is different than Candida. Candida is a more common and typical organism that you're going to see in the gastrointestinal tract, and it's actually okay to be in the GI tract in low numbers in birds, and it doesn't cause any problems. So my guess is that this individual, and of course I don't know for certain, but my guess based on what was said is that they may have had a Candida infection and a Clostridium infection, possibly. Why was the yeast infection treated with antibiotics? Well, maybe the more appropriate term, and I don't know how it was said to the owner, is maybe they should have used the term antimicrobials, because antimicrobials is a more like broad term that means whether it's antibacterials or antifungals, those are both fall under the category of antimicrobials. So, because you're not going to use an antibiotic to treat a yeast infection, but you're going to use an antimicrobial, or more specifically, an antifungal to treat a yeast infection. Because this patient may have had 2 things going on at the same time, the vet may have prescribed a antibacterial if Clostridia was present as well at the same time.
Okay, sorry if I killed words there.
That's okay.
That was you covered a lot, and we did have a lot more questions but I think we kind of thank you for going over time with that. And if we didn't get to the questions, if we didn't get to your questions, we'll try to email you answers. Dr. Lamb will take a look at those for us, because you're best. And I got to announce today's winner, because we have a giveaway. It's a special giveaway, actually. It's the new apple Nutriberries. So it's the newest flavor of Nutriberries, which is the apple flavors. Apple berries, as well as another Lafeber product of your bird's choosing. And that is, who's that going to? Where'd it go? Cassie Cherney. Congratulations. That'll be going out to you. And oh my gosh, so we're going to be back in May. So we're going to take the spring break here for April. And yeah, we'll see you guys back in May. We'll see you back in May, Dr. Lamb. So, yeah. Another deep dive topic coming our way. Do you know what the I haven't had a sneak peek yet.
I think I know my next 2 topics are, one's going to be aspergillosis and one's going to be mycobacteria. I just can't remember which one is May. I don't
Okay.
remember aspergillosis first or mycobacteria first.
One of those two. They're another deep dive. Okay. I just want to thank everyone for joining us. Dr. Lamb, again, you are a trooper and you've been on us for 5 years. I just wasn't mine. So thank you so much.
Yeah,
I
of
want to wish
course.
everyone a fabulous weekend, a great spring break if you're taking one, and all the best to you and your flock. Till next time. Bye, guys.
Bye.